The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another issue of Inside JACC. And one of the newly discovered syndromes in cardiology that's attracted a lot of attention is called apical ballooning syndrome, often commonly called Takotsubo syndrome, and most recently called stress cardiomyopathy. The implication there, of course, being that stress plays an important role in this disorder. And we've got a paper in press that's really fascinating that addresses this very issue. The senior author is with us, Dr. Amir Lerman, and Amir is professor of medicine and associate chair of academic affairs at the Mayo Clinic. So Amir, tell us about your study and how you went about sorting through the potential mechanisms of Takotsubo.
So thank you, Tony, and I appreciate the opportunity to be here. The major intriguing part, as you indicated, is the role of stress in this particular syndrome. And the question that we ask is that a coincidence, or this is an inherent a characteristic of this patient that present with stress-induced cardiomyopathy. So we set an experiment by which we look at this patient that had an episode of apical ballooning and to check their response, vascular as well as endothelial response to mental stress.
Very clever approach. Go ahead, Amir.
So we call these women that have this episode and compare them to postmenopausal women as well as women that have ST elevation myocardial infarction, and set an experiment by which they're exposed to mental stress, and we follow their vascular reactivity as well as the acute effect of mental stress on the vascular response.
So as I recall, you compared a group of women with apical ballooning syndrome to women who were a comparable age in postmenopause without the syndrome, and a small group of comparable women who had previously had an acute myocardial infarction.
That's correct. And the result shows that in particular the women that have a apical ballooning syndrome have abnormal response to mental stress, which was characterized by initial decrease in vascular response to mental stress, as well as a decrease in their peripheral endothelial function in response to the mental stress, as opposed to the other groups.
So this supports the concept that stress really may be the etiology in this syndrome.
It supports two concepts, as you said. One of them, that stress may be one of the mechanisms which mediate to vascular activity that mediate this syndrome, because as we know, they have normal coronary artery, they don't have any significant obstruction. And second concept that is growing and addressed in your journal is the effect of personalized medicine, and the effect that each person may have a differential and individual response to environmental risk factors.
So is there any therapeutic implication here in your finding?
That's a good question. This study, we did not address any therapeutic, but I think it has an implication of therapeutic, since first initially you can use this methodology maybe to screen this patient and to see if they are more sensitive or responders to mental stress. And if this is the case, then you can design pharmacological and non-pharmacological therapy to somehow change the response to mental stress to where you want it to be.
Well, these are fascinating results, and in terms of what has been a fairly confusing syndrome in terms of etiology, I think they provide some tangible evidence that stress may in fact really play an important role. We thank you very much for being with us. For Inside JACC, I'm Tony DeMaria.